Hypertension is the measured change in the pulse and the resting phase pressure in the peripheral circulation. The heart is pumping against the blood vessels that should respond to the heart. In a healthy circulatory system, blood vessels provide around 3/4 of the pump action, moving the blood, oxygen and the nutrients to the peripheral tissues. All of the blood flows back to the heart, and it results from the peristaltic wave of the contraction of veins back to the right side of the heart. To lower blood pressure, we must improve blood vessel secondary wave contraction and support mitochondrial metabolism that makes up 3/4 of the muscular middle layer responsible for the flow. To lower blood viscosity is also essential. Reduce free radicals that make the vessels stiff with oxidized plaque from the fatty acids and cholesterol that's been damaged. Singlet oxygen radical, hydrogen peroxide radical, and nitro peroxide radical must also be quenched. A byproduct of inadequate metal group transfer from folate B12 and metal group deficiency is homocysteine, and this must also be reduced to prevent the vessel wall injury. Cholesterol is not dangerous to the artery, but small particle HDL and VLDL3 can be swallowed by macrophages and die, becoming plaque-forming foam cells. They release local molecules that can cause fibrin and platelet aggregation like a tar. There's many factors that can contribute to hypertension, like genetics, environmental factors, inactivity, salt, stress, nutrient deficiencies, age, alcohol, smoking, and being overweight. Diet advice would involve low carbohydrate, low GI, low salt except for sea salt or Himalayan pink rock salt, high fat, moderate protein, and high minerals. As well as their many benefits such as improving mood and cognition, omega-3 fish oils contain both DHA and EPA. The omega-3 fatty acids are essential nutrients that are important in preventing and managing heart disease. Findings show that omega-3 fatty acids help to lower blood pressure. Common doses range from 3 to 9 grams per day of an EPA-DHA blended molecularly distilled fish oil. Magnesium is a mineral that's critical for many bodily functions, including blood pressure regulation. Studies show that magnesium supplements may help to reduce blood pressure by increasing the production of nitric oxide, which is a signaling molecule that helps to relax the blood vessels. Magnesium intake of 500 mg to 1000 mg per day may reduce blood pressure as much as 5.6 over 2.8 millimeters of mercury. In order to best determine your dose, slowly increase the amount of magnesium bisglycinate that you can take each day until side effects like diarrhea or stomach discomfort occur. Then gradually reduce the dose until you're taking the maximum amount that doesn't cause any digestive discomfort. As magnesium is required by hundreds of enzymes in the body, it can produce profound health benefits after a few months of supplementation. As well as magnesium, zinc is also required for the proper functioning of around 100 enzymes in the body, and zinc deficiencies are common. Lower than normal zinc levels may contribute to high blood pressure by altering the way that the kidneys handle sodium. Be sure to get the recommended 30 to 50 milligrams per day of zinc in a highly absorbable form. It was concluded that a vitamin E supplement of 200 international units a day can be effective in mild hypertensive patients in the long term, probably due to nitric oxide and improvement in the blood pressure status. Be sure to take a mixed tocopherol natural form of vitamin E and not a synthetic one. An Italian study in 2013 reviewed the role of vitamin D supplementation on regulating the blood pressure in the body. Vitamin D may be more effective in lowering blood pressure in people who have lower levels of vitamin D. However, most people are deficient in this nutrient. Get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Vitamin D works synergistically with vitamin K. Low vitamin D and K status has been associated with increased blood pressure and a trend for greater hypertension risk. Vitamin K1 is primarily involved in blood coagulation. Vitamin K2 may have a more diverse range of functions in the body. It was labelled Activator X by the dentist Weston Price, who was studying the relationship between diet and health problems, and he considered it to be one of the most overlooked essential nutrients in our diet. The maximum amount that your body can absorb per day is 300 micrograms, therefore more is not necessary. The best form of vitamin K is as Mk7. Glutathione is known as the body's master antioxidant. Glutathione is a major intracellular thiodisulfide redox buffer. It serves as a cofactor for many antioxidant enzymes. Glutathione-related parameters are altered in hypertension, suggesting that there's an association between the glutathione-related redox system and hypertension. You can increase glutathione by taking reduced glutathione at up to 1 gram per day, taking S-acetylglutathione at 200 milligrams per day, taking the precursor N-acetylcysteine at 500 milligrams 3 times per day. Ensure that you get adequate selenium of 200 micrograms per day by eating 3 Brazil nuts, taking the herb milk thistle and eating asparagus. Dietary intake of vitamin B6, B12 and folic acid has been reported to reduce the plasma homocysteine level. These vitamins may have an influence on blood pressure levels by mediating the effect of homocysteine. B1 has beneficial effects on blood pressure of individuals with hyperglycemia, as it lowers the diastolic blood pressure and the mean arterial blood pressure. Make sure that you get a quality B vitamin with B12 in the form of methylcobalamin. You should check out my video on the MTHFR polymorphism, because if you have that, you're at a higher risk of higher homocysteine levels, but this can easily be controlled with supplementation. Ubiquinol CoQ10. In the analysis of 12 clinical studies, research has reported that CoQ10 has the potential to lower the systolic blood pressure, the top number in the blood pressure reading, by up to 17 millimeters of mercury, and the diastolic pressure by 10 millimeters of mercury, without significant side effects. Doses are anywhere from 200 to 400 milligrams per day of ubiquinol. CoQ10 works synergistically with PQQ at doses from 20 to 40 milligrams per day. Hypertension is responsible for at least 45% of deaths due to heart disease and 51% of stroke deaths. This is according to the World Health Organization. L-citrulline is a non-protein amino acid, and it's being investigated for its effect on lowering blood pressure. Citrulline produces several important effects in the body. One major way that it works is by increasing vasodilation. Vasodilation refers to the widening of the arteries or the veins. It's associated with lower blood pressure and increased blood flow. Some research has shown that oral L-arginine can lower blood pressure in healthy people, people with mild blood pressure elevation and with diabetes, and in people with a type of high blood pressure that affects the arteries in the lungs and the right side of the heart, known as pulmonary hypertension. Typical doses are 1 teaspoon of L-arginine and L-citrulline in a glass of water. This can be sweetened with stevia and taken once or twice a day, either first thing in the morning or last thing at night on an empty stomach. Beetroot contains naturally high levels of nitrates, which your digestive system converts to nitric oxide. This compound relaxes and widens blood vessels, which in turn lowers blood pressure. Cayenne opens up blood vessels to help to increase blood flow. This decreases the blood pressure naturally by increasing the rate that the blood flows through your system. The famous herbalist Dr. Christopher added cayenne to all his remedies, as he said it had a profound balancing effect on the body. Garlic supplements have shown effectiveness in reducing blood pressure in hypertensive patients, similar to first-line standard anti-hypertensive drugs. Kyolic, which is fermented garlic, has also shown promise in improving cardiovascular health by reducing arterial stiffness, elevated cholesterol levels, and blood stickiness. Hawthorn is used to help to protect against heart disease and to help to control high blood pressure and high cholesterol. Both animal and human studies suggest that hawthorn increases coronary artery blood flow, it improves circulation, and it lowers blood pressure. As hawthorn is closely related to apples, it's often consumed like a fruit in high quantities. Some consider hawthorn to be an adaptogen, with the berries supporting the physical problems of the heart and the flowers supporting the emotional problems. Valerian may have a sedative effect. It may have a stimulant effect for extreme fatigue. Valerian root may lower blood pressure and relax the muscles. Passion flower. Blood pressure levels were significantly reduced, likely due to the GABA promoting properties of the plant. Passion flower also has antioxidant enzymes that help to lower blood pressure. L-theanine from green tea tends to decrease blood pressure in the systolic and the mean blood pressure. The heart rate was not affected by various doses of theanine, however. Bilberry may help to lower blood pressure, reduce LDL or bad cholesterol, increase HDL or good cholesterol, and protect you from blood clots, thus improving your heart health. According to scientists from Johns Hopkins University School of Medicine, high doses of vitamin C, an average of 500 milligrams per day, may produce small reductions of blood pressure. Vitamin C may act as a diuretic, removing excess fluid from your body. This may help to lower the pressure within your blood vessels. The best form of vitamin C is liposomal vitamin C, then a pH-buffered, non-acidic vitamin C form, with the worst kind being cheap, acidic ascorbic acid. Vitamin C's action is enhanced when taken with flavonoids, such as the bioflavonoid quercetin. Flavonoid compounds, including flavonols, flavones, and isoflavones, present an important source of antioxidants in the diet. Lower blood pressure through the increased dietary consumption of dietary antioxidants may decrease the rate of end organ damage that's secondary to the hypertension. Taurine is a type of chemical called an aminosulfonic acid. It occurs naturally in the human body, and it has many important functions. Taurine is found in large amounts in the brain, the retina, the heart, and blood cells called platelets. The best food sources are meat, fish, and eggs. Taurine has been shown to lower blood pressure in several hypertensive animal models. Doses can be 1 to 3 grams per day. As the main cause of hypertension is diet and lifestyle related, you should exercise, eat a healthy diet, and learn to safely manage your stress levels. You should try to give up bad habits such as high salt and sugar and stop smoking. Never assume that the damage is already done and that it's too late to change and to heal. You can take herbs and supplements to help to speed up your healing, and you can also learn to incorporate these healthy herbs and foods into your diet to maintain a healthy blood pressure. For more information about the herbs or supplements discussed in this presentation, go to my website.